want you to give me your, just like a deposition, give me your name, rank, and serial number.
My name is William Henry King III. I am the pastor of the Greater New Hope Missionary Baptist Church. I am the chief chaplain of the Dickinson Police Department. I'm also the area state rep for the ICPC Region 7, and I'm also the chairman of the membership committee.
Tell me some of the, how long have you been a chaplain?
I've been a chaplain now for 14 years at the Dickinson Police Department.
You're a kid.
I am 42 years of age.
Okay.
Yeah, okay. I started pastoring when I was 27 years old.
Are there any events that you have participated in that perhaps we would know that some of the national crisis have you responded to, or 9/11, something like that?
I was not able to respond to 9/11 in New York. However, I did respond to the BP explosion in Texas City, where we provided crisis intervention, compassion and fatigue counseling to the families that were impacted by the deaths of their loved ones at the BP explosion.
Tell me a little bit about compassion and the word you used.
Crisis intervention.
No, I mean
Compassion fatigue.
And that's something that chaplains, obviously, in a situation like that, have got to deal with. How have you ever felt it? Because I wonder if that's just something that comes upon you immediately, or if it's something that you feel coming on, or...
Sure, compassion fatigue is something that every person involved with crisis experience, traumatic experiences. It is something that many times it takes a skilled, trained individual to be able to detect. Many times the person who's experiencing fatigue may not realize they're actually having fatigue because of the run-of-the-day activities that they're so accustomed to. But when someone who knows and been trained, and that's why I certainly appreciate ICPC, because they provided the educational training so that I could acquire the knowledge and the skills to be able to identify it. When you see it, then you're able to know it, and when you are able to detect it in a person, it's not a direct engagement, but just letting the person know that you're there, letting the person know that there's a presence that's available. It's almost allowing a person to catch their breath.
How do you, because that can be, someone can be greatly offended if you,
Sure.
if you don't do it correctly.
Sure.
And first of all, what are the signs, and then how do you politely or gingerly tell them, you've got to, I can see the signs coming on.
Sure. The important thing is to identify fatigue. Sometimes people can be exhausted, be tired. You notice a change in their behavior, the cognitive articulation of particular subject matters, how they word it, how they communicate those thoughts. And it could show the signs of exhaustion, so the signs of being weary. If you're used to your partner or used to the person that you're working with, and you notice their appetite has changed, and you see the different signs. So if they're not saying it, you see it in their behavior. Then you're able to just gently, cautiously, how are you doing? How do you feel? What are you experiencing right now? What do you think about this experience? And normally, they will let you know what's in their heart. This important thing is to always start with the head, look at the cognitive things, and then you go with the gut, those emotional things, and they express that. And you're never complete identifying compassion fatigue without going back to the head. That in spite of what you face, in spite of what you experience, you can make it. I'm here for you.
How do you avoid asking them in such a way that they go, back off, or
you should never be direct in the sense that you need help, or you need to go see the psych, or you need to go see the doc, or something of that nature. You always use compassion. And that's why we call it compassion fatigue, because this demonstrates love. And the Bible tells us that we speak the truth in love.
There are certain qualities that make up a good minister, and there are certain qualities that make a good chaplain. And what are those differences?
I think the principles that we experience in chaplaincy and the principles that we experience in pastoral care are unique within themselves. However, I think you differentiate in that as a pastor, you may use more scriptural references, whereas a chaplain, you're not trying to be spiritual in the sense that you're trying to throw Bible at them, because we don't practice trying to proselytize. We don't practice that type of behavior. It's the ministry of presence, and through the ministry of presence, we gain the trust and confidence of our officers, and then we're able to navigate them into areas where they can find comfort.
Explain the ministry of presence.
The ministry of presence is a very powerful ministry in chaplaincy. I learned in ICPC, in that it's not what you say, it's just being seen. And so just your presence. And when the officers, when the police department that you serve know that you're on campus, know that you're on site, know that you're in the station, it sort of brings a calmness, a quietness. It's like being in a tremendous storm where the lightning is flashing and thunder, but you know mom is in the room with you. There's no need to fear.
Yeah. Tell me, do you ever guard yourself from certain types of behavior because you know that if I do this now, someday this person is going to need me, and I will have diminished my...
You always practice discipline as a chaplain. It has to be the fundamental principle or foundation that every chaplain has to embody, the discipline that you don't compromise. You're not an officer. You're not wearing the badge or the gun. You're wearing the principles of hope, of encouragement. And so you never compromise yourself in the sense that you want to gain something personally for one moment of gratification, and whereas it will cost you an enormous weight of glory and on the back end of it.
Yeah. That would be terribly difficult.
That would be horrible. That would be devastation. That would be a tsunami.
That'd be terribly difficult for me to do, I think. That'd be the most, to hold my tongue, but obviously, is it difficult for you to do, to always be at that level of knowing that you're a chaplain and have to, because there would be certain times when I would want to speak frankly and it would be taken out of context later.
Sure, there are times that subconsciously or consciously you feel like becoming maybe a dad or becoming a big brother, or taking on a different role. And so it's important to stay in your lane. And Dad taught me this growing up as a young 13-year-old when I first started driving. He said that we're driving on a country road, which means we can drive in the middle of the road until another car comes along. But we got to the city. He said there's stripes on the road for a reason, William. And you have to stay in your lane, because the danger and the tragedy of not staying in your lane is you're going to create some type of disaster. And so the importance of chaplaincy is that we're able to physically, mentally abide within the parameters of our function so that we can effectively work to the betterment of the whole of the department.
How do you overcome, I would always feel when I'm counseling somebody in great stress that I'm saying something that's pat or something that's lame, and obviously you have come to some sort of philosophy about that, and the worst thing you could do for me would be to say something that I would consider lame at that point. And because I would, well, like most people, you reject it and you don't know where. How do you find the words that you think have resonance?
Yeah, sure. The process of training provides us with the skills in the curriculum so that we're able to select, to choose. It's sort of like cooking. You have to there's a certain recipe to make sure that the flavor is there, but it's not so overbearing and overwhelming that the person can't enjoy the meal. And so part of chaplaincy is being trained so that we're able to articulate a message that's powerful in substance, but it's calming in the fact that the person that we're ministering to has an ability to say, thank you, I appreciate, I needed that. So like the commercial where the fellow slaps his face and say, thanks, I needed that. And so chaplaincy provides us with the ability so that we can select our words in a manner that we're not offensive, because we've already evaluated the situation and we know exactly what we're dealing with. It's not something you do off the seat of your pants. That's why training, it's so very vital and important in chaplaincy, so that you know exactly what needs to be done. You do it, and then you know when to stop and not move beyond that point.
Advice, I guess, to a young chaplain who's just beginning, and a mistake maybe that you made, that you can remember when you first began, and if you learned something from it, what would come advice?
My advice to a chaplain who's just engaged the law enforcement chaplaincy is to learn, get as much training as you possibly can. And when I first started chaplaincy, our department did not provide assistance to travel to ICPC. We did that out of our own financial resources. So it's an investment, and I think President McDuffie says it's a sacrifice. And so you have to make the sacrifice, get the training. And then once you've been trained, once you've been taught, then the important thing is to know how to use it properly, to use it wisely, so that you're able to provide a service to the officers. My mistake as early chaplain, and when I first started chaplaincy in the 90s, 1996 thereabout, was that I was eager to get involved. I was very engaged and compassionate about being involved, but I didn't have all the tools. It's like being in the kitchen. You want to prepare a meal, but you don't have the stuff you need to get the job done. And so I was wanting to provide a service, and because I didn't have the training, that I didn't have the educational abilities that chaplaincy requires, I went in like a pastor, and because I had the pastoral training, and as a result, it's different. As we talked about earlier, you have to differentiate in that you're not the pastor of the police department. You're in the ministry of presence, and so my mistake early in chaplaincy I was too forward, too overbearing, and as you indicated earlier, you can create an environment that rejects or that pushes officers away instead of compelling them to you. And so it took me a few years to overcome that. And as a result of them seeing how committed I was in heart, they gave me another chance. And that's why I'm still here.
Let me ask you a tough question. And this is advice to the survivor, but advice to the survivor the night after, the night of, okay? And they're not sleeping. No one sleeps that night, I'm sure. What words can you give?
Sure, if a person is a survivor, I first want to make them know that I'm there. I may not be quick in words and using words and terms.
You speak directly to them. What would you say directly to them? Because one of the things we're going to do is make these videos available to people who are sitting up through the night and have just experienced a loss.
Yeah.
In other words, you're speaking to them as if one of them said.
Okay, sure, okay. I'll make sure that you know that what you're feeling, it's okay. The feeling of not having a desire to sleep or eat or drink, feeling lonely or abandoned, those feelings, I understand that you feel that way. I understand that you're hurting and you're probably not even wanting to have a reason to live. I understand that. It makes sense to me. What you're experiencing is normal for such an abnormal experience. And that you know that we're here, that I'm here, and we're going to make it through this. That'd be my initial dialogue with them.
What are the differences between someone who is able to deal with this kind of thing well and someone who is not? Are there things that are involved?
Key things of chaplaincy is being able to, again, identify symptoms. And chaplaincy doesn't mean we're clinical psychologists. We need to know our limitations and be able to refer. And everyone processes stress or processes trauma differently. And so because of that, I would be able to speak to them in the capacity that I'm able to. And then if I see someone who's grieving to an extreme point, then I will refer them.
How do you identify someone who is kind of a little bit of a time bomb? You can see that they are not now, but maybe in a year. This is going to, for sure. Is there any way to tell in that crisis time that this person is going to have a problem with this a long time from now? A year, 2 years? Is there a way to tell?
Yes, there are symptoms. And the symptoms that we can detect is through the debriefing after the shooting. Once we get back to the station, there's a debriefing. You can normally expose certain behaviors or thought processes based upon the debriefing information that they will release to you. If at that point you create sessions with them that you're going to communicate or talk to them, and from that particular point, you again discern or you evaluate what they're saying, what they're telling you, what their information they're providing to you. And if you see that this person is going to do harm to themselves, this person has the behavior, the symptom that's going to do harm to someone else, then you immediately refer them so that they can get the help that they need.
Is there? I would think it would be best to talk to someone in an unscheduled encounter. Is that? I mean, if you have someone pull them into your office, they sit down, they cross. I would think that'd be a very difficult way to do it. Do you?
Crisis intervention is important, that if you're out on patrol with the officer, you're doing a ride along, or you're at the station, you're standing in the hallway, you just walk up and you gentle, low-key conversation, and you happen to see some symptoms, then you can ask that officer. Most of what I do is I ask, let's take a walk outside. Never, ever do I ask them to come to my office, because I don't want other officers to perceive, and I don't want them to be alienated, to feel as though, okay, the chap has pulled me in the office, something serious is going on. So let's take a walk. Let's walk outside. Hey, you ready to leave out the station? You mind if I ride with you? And so then, once we're one-on-one, we can talk, and we provide the service to them that they need, either to deal with whatever they're dealing with, or if not, if they say, you know what, I do need some assistance, then to create an atmosphere where they can get that without being alienated to the department. Okay.
Excellent.
Is that okay? That's off the cuff there.
You did great.
Did I?
You did great. Thanks so much, brother. And
Thank you, sir.
we'll show you still get it edited down, but we're going on something.
Sure. Wasn't dressed for the role. I could have, should have had an
Perfect.
ICP shirt.
No, you're perfect. Don't worry about it.
If you have any digital images, I may have of your role.
Pictures, anything that you've
Sure,
had taken
on my
of you, that's,
Okay. I'll get with you or
he'll email
the
you, and then
office
you email
will,
us something when you got
so
some
we can
time.
insert those.
Because while you're talking, we'll do
This
some
is
pictures
really
and
going to be
stuff.
professional. Huh?
Yeah, yeah.
You're really
Our website
first class.
is PoliceUSA.com, and look and see some of the things that we're. It's right on here. It's on here. Thank you, sir, Mayor.
Fantastic job.
The website on there. It's PoliceUSA.com.
Oh, you have it here.
Yeah.
And King is the mayor pro tem of his community, so he's involved in the government side of.
Between Houston and Galveston on I-45 South, we're the hub of Dickinson-Galveston area.
Okay. Well, I've been at the Hotel Galvez.
Okay, well, you have to drive through Dickinson.
Great memories of the Hotel Galvez.
You look familiar for some reason. You ever worked in the Dickinson-Galveston County area?
No.
Why you look familiar?
Post
I've
office
been
ball.
told it up like a lot of people.
Say post office ball.
I'm just kidding, brother.
When I got this haircut, I started looking like a lot of people.
Yeah, when I got this one, I started looking bald. Brother, God bless you.
God bless you.
So
Thank you
much for your
again.
time. I know
And,
you
hope I was
did. I know you
benefit
were,
to
and I
you.
know you had to slide out of a class, but it's for a good cause.
Love you.
God bless you, brother. See you soon. Thank you.
Gonna make it to the business meeting here.
All right, thanks. The next one, if you, this is